Are you struggling knowing how to prepare for your OET reading? Then watch this video where I show you what to do in order to pass. Let's go! Hello! I'm Jo from Specialist Language Courses. We are OET Premium Preparation Providers, which means you are in the right place for all things OET. Don't forget to subscribe to our YouTube channel and hit that bell so you're notified every time we upload a new video. Let's get started. There are 3 parts to the OET reading. Part A, which lasts 15 minutes, followed by parts B and C, which you need to complete in 45 minutes. Let's start by looking at reading Part A. In this part, you receive a text booklet with 4 short texts commonly found in the workplace, and these are all on the same topic. You also have a question paper. There are 3 sets of questions, a matching task, sentence completion task, and short answer questions. You only have 15 minutes to complete 20 questions and you must spell the answers correctly. For reading A, you need to use the right strategies in order to finish all the paper in time. Let's take a look at what you need to do first. Do not read the text. You simply do not have time. Instead, have a quick look at the text to notice what kind of information is in each one. Pay attention to headings such as here, the different types of burns, and here for fluid resuscitation, where it is also divided into adults and children. Here we have management for burns, which is numbered in order of completion, and we can also notice that there are lots of instructions here. There is often a table in one of the texts, such as here. We have information about adult and pediatric analgesia. Pay attention to the table headings and don't forget you may need to find information from outside the tables, such as here and here. So what strategies should you use to complete the tasks? Let's take a look. Complete the matching task first, as it will prepare you better for the other tasks. Decide which text would contain the answer and check the text only if needed. So for this one, which text would the answer be in? How to categorize the severity is definitely going to be in text A. Let's move on to the other tasks. For sentence completion, you should ask yourself, what kind of word am I looking for? For question 7 here, it is a noun. What will they experience in addition to shrinkage? I also want to focus on what words and phrases will help me find the answer, here being 3rd degree burns and shrinkage. Then I need to decide which text should I look in, and for this one it's probably going to be text A. You then need to look in the text and scan for 3rd degree and perhaps a word meaning the same as shrinkage. And here we can see considerable contraction, so we know the answer is scarring. For short answer questions, you follow the same strategy. What kind of word am I looking for? So for question 15, it's maximum number of tries. What words and phrases will help me find the answer? So here, attaching a drip at the scene. And also, what text should I look in? For this one, text B. We then need to scan to find the answer. And here we can find intravenous fluids and on scene. And we then read, should not be delayed by more than 2 cannulation attempts. So we know the answer is 2. So how can you improve your reading skills for part A? Let's take a look at some things you can do. You need to practice your scanning skills. Use websites such as Patient Info and the NHS and scan for high occurring words, such as here for burns assessment, we could scan for all the mentions of burns. Or perhaps numbers. Or you could work with a colleague and write questions the other one has to scan for, such as this. How long will it usually take a patient with an epidermal burn to heal? Can you find the answer? And here it is, a week. Now let's move on to parts B and C. You have 45 minutes for both parts B and C, so we recommend spending about 10 to 15 minutes on part B and 30 to 35 minutes on part C. For part B, there are 6 short texts commonly found in the workplace. Each extract will have a question and 3 possible answers to choose from, and you mark the answer by colouring in the circle with a pencil. Let's take a look at the strategies to use for reading part B. Read the question and make sure you understand it. If it is not a question, think about turning it into one to help you focus. For example, here you could ask, in what circumstance can a doctor break patient confidentiality? Read the options and notice the differences, or you can do this after reading the paragraph if you prefer. Read the text and look out for links to the question. Eliminate any obvious wrong answers and choose the correct answer. Be careful of distractors. We can see here that option B is mentioned, but it does not answer the question. We can see the condition for breaking confidentiality highlighted in blue. So how can you improve for part B? Let's have a look. If you can, read notice boards around the hospital, at the dentist, etc. Read policies on websites and documents in the workplace, such as instruction and procedure manuals. Write down formal verbs and phrases and learn their meaning. For example, outline, establish, conclude, account for. What formal verbs and phrases can you find in this? Here are some examples. Don't forget to write them in your notebook and review regularly. You can also practice breaking down the text into main ideas. Summarize in your own words to focus on the main points. For example, here, the first part talks about how confidentiality is important to ensure medical attention and good care. It then says information can be disclosed without consent if someone is at risk, and goes on to say that patients should be informed of this in advance where possible. And finally, let's move on to talk about reading part C. For part C, you have 2 texts and 2 sets of questions. They are much longer and there are 16 questions in total. Each extract will have a question and 4 possible answers to choose from, and you mark your answer by colouring in the circle with a pencil. So what strategies should you use for part C? Let's look at that now. First of all, number the paragraphs in the text so you can find the right paragraph quickly. Read the question and make sure you understand it. Read the options and notice the differences. Read the text and look out for links to the question. Eliminate any obvious wrong answers and choose the correct answer. However, you might find it better to read the options only after you've read the paragraph to avoid getting distracted. Try both ways and see which one works best for you. Over to you. Read this paragraph. Which option is correct? D is the correct option. For part C, you will always get 2 lexical reference questions. You need to work out the meaning added or what is being referred to by using the context of the paragraph. So how can you improve for part C? As well as doing practice papers, it's really important that you develop your skills and practice reading longer texts. Let's take a look at some ideas you can do. Read, read, read as much as you can. Here are some good websites for texts. And here are some activities to try with texts. Summarize each paragraph in 2 to 3 sentences. Find all the linking expressions in a paragraph. Decide if they are contrasting, adding, expressing results, etc. Make a note of language used to express attitude and opinion. Make a note of evaluative and hedging language. Make a note of cause and effect language. Now look at this text. Can you find any language that express attitude and opinion? And here are some examples. You can also use any text. Find reference words such as this, it, they, and work out what they are referring to. Have a go at this now. What do these words refer to? So the first it refers to high blood pressure. They refers to 5.6 million people in the UK. The next it refers to high blood pressure again. And the it here refers to blood pressure. And the final it refers to pressure. Here are my top tips for reading. Use your scanning skills for reading Part A. Be careful of distractors in reading B and C. Develop your vocabulary and knowledge of language commonly used in Parts B and C. Read a variety of texts to improve your reading skills and succeed in the OET exam. I'd like to know which part of the reading paper you find most difficult. Let me know in the comments below. And if you like this video, please like and share with your friends and colleagues so we can help more people achieve success in the OET exam. Don't forget to check out our website, the links below, to see how we can help you with your OET preparation. See you in the next video. Bye! As well as doing practice papers, it's really important that you develop your skills for reading. La 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 la. Are you stuck with OET reading? Want to know how to pass? Do you struggle knowing what to do? Are you struggling with your OET reading preparation? I don't know what I'm saying. Okay, don't forget to subscribe to our YouTube channel. And hello, I'm Jo from SLC, Specialist Language.